This is a quick tutorial video on setting up the BiPAP using the TV100. Here is a look at your setup. Notice the circuit, mask, and 2 viral filters. These are the only supplies you need to initiate BiPAP. The supplies are located in the main stack room, to the left as soon as you walk in. On the top shelf on the left, you will find the circuits for adults and pediatrics. The same circuit set is used for intubation and BiPAP. Generally, we do not put pediatrics on BiPAP. The viral filters are located on the second to last shelf next to the incentive spirometers. The masks are located on the bottom shelf to the right. Masks come in small, medium, and large. Choose the mask that you believe fits your patient the best. When you open up the circuit, you will notice 4 attachments. You will use all except the angled one on the bottom. First, take the multi-level connection and attach it to the outlet valve. This is where one of the viral filters will go. Next, connect the extension tube to the outlet valve end without the multi-level connector. Now you can attach the small connector piece to the end of the extension tube. This end will connect to the patient's mask. The last part of the circuit are the viral filters. One attaches to the multi-level connector you put into the outlet valve. The other goes on the end where the circuit will connect to the TV100. The mask will attach to the end closest to the outlet valve with the viral filter on it. You should ensure the mask fits the patient before connecting the tubing and starting the machine. If a nebulizer is ordered, use the nebulizer kit. You will need the tubing, neb, and T-piece. It will connect between the patient and the outlet valve. After connecting to the patient, ensure the neb is upright so the medication doesn't leak out. Then attach to a separate oxygen flow meter. To connect the circuit to the TV100, attach the viral filter to the largest connection on the machine. Then connect the small tube to the small connection and the larger tube to the larger connection. Now you can turn on the machine. Ensure the tubing is connected properly and machine is turned on. The first screen is the patient type screen. You will select Adult and Continue. The machine will default to volume AC. This is the setting for a vented patient. Press Mode and change it to NIV, non-invasive ventilation, then press OK. This is the screen you will use for BiPAP. You can change the inspiratory pressure or IPAP by pressing the button and either using the arrows or numbers to set the pressure and pressing OK to close it. Next, you can change the expiratory pressure or EPAP by doing the same thing. These settings will be given to you by the provider. Notice the oxygen button is grayed out and you cannot change the oxygen level. This is because the machine is not attached to oxygen. Ensure the oxygen flow meter from the machine is plugged into wall oxygen. Do not turn the flow meter on. This will create low pressure alarms. Now you can press the Start Ventilation button. This is your main screen for monitoring your patient. You can stop and pause the treatment from here. Tabs at the top of the screen allow you to view different menus. The Parameters tab allows you to see and change the initial settings that were chosen. You can see oxygen is no longer grayed out. You can change the amount of oxygen delivered from this button. The Alarms tab will show you another overview of the settings and which ones are alarming if an alarm is triggered. The Monitoring tab gives you another overview of the settings and status of the patient. To turn off the machine, press and hold the power button. Then press Power Off.